Thanks, you got me back again. So I'm going to talk a little bit about holding the gains and preparing for spread. Now, some of the slides that some of us who work in quality improvement put up, you're going to see repetition, and that's because we think about these and all use the same tools. But they're usually good things to think about. And spread will be one of the most challenging things that we do in this program. So I'm going to talk a little bit more about that and just about preparing for spread. We're not at spread, but this needs some pre-thinking about. And so that's why I want to spend quite a bit of time talking about this. Some of the objectives are starting to consider some of the ideas and things that you need to be thinking about when you prepare for spread. And we've heard a few of those things, and we can see the thing from Lucille and Ethel when things don't go well with spread, and that you've got a workforce that really can't cope with what we're being asked to do, and we won't get spread. So in the improvement journey, we got started, and that was a big effort, and we've got people engaged, and while we're looking around the room, we've got a lot of people engaged and a lot of great work going on. I think we were quite clear about the problem, and we did at least have a problem that was quite reasonably well defined, and we had good background data, which has been helpful. I can hear today around what we're doing and about understanding the nuances in each of your systems. Your different systems work slightly different, and even within one organisation, one ward to the next is different. So we're starting to understand how things work and how it works not just in the inpatient unit, but that connection to the wider system of care. And so we're seeing that we're now in that designing changes, testing changes, and continuing to evolve and learn. The next phase that we're preparing for is refining those changes, being confident that they work in across the setting and getting them to happen reliably. And then we want to be able to spread those key components across our organisation about what are the levers. Have we done the things around cultural safety? Have we done the things around violence reduction? All those key components that we can see that are common threads, how we work on those and spreading the change. So the challenge is not starting, but to continuing after the initial enthusiasm has gone. So when you leave here, we don't want to see the enthusiasm drop. We've seen lots today, but we've got lots more to do. The good news is we're really well on the way. The not so good news is we still have a way to go. Now, the other slide that I didn't put in here, but I'll just show it to you because you've had it on the table, is this. And I thought this was brilliant, and it really is quite thought-provoking. And there are 24 ideas in here about why your changes are fail. And they're all things to consider, and I think we've heard a lot of them. And there are around things about, distributing leadership, about co-design, about using each other, about networking with others, about listening to ideas. But I think this is really useful, and it might be something that if you have a visual board, putting up there so people can start thinking about this as we plan for spread and sustainability. So just to talk a little bit more, I thought this was very useful. In the final stage of the quality improvement project, the team will work to embed the ideas that have been tested and shown to work in multiple contexts in day-to-day operational practice. This still requires PDSA, so we will continue to use PDSA. It is our new best friend. We're looking at bigger cycles of change, and when you start to scale up and you're looking at not just one patient or 5 consumers or 10 whānau, about how we do this all the time, and that scale requires you thinking a lot more ahead in your planning phase. You're going to need to think about if we've got a new way of doing things, are we going to need resources to do them at scale? If we're going to have the whole unit or the whole thing, are we going to need business cases? Are we going to need to change certain things that will require additional resources? And we need to prepare our leadership for that and thinking about, actually, we've learned this. Now for us to do this, we're going to require resource to do that. And that's things that you'll need to start preparing and thinking about. So when we're creating new systems, we start improving. We learn our way to that. We settle the system down. We hold those gains. We spread them across. And then we start looking at the next. This is a continuous improvement process. And we heard that in the video today. This isn't a 2-year project. This is the new way that we start thinking about and looking how we improve care. Testing versus implementation. Testing is trying, adapting with existing knowledge on a small scale, learning what works in our system. Implementation is making it the new way in which we work. a key test about how well your change is embedded. If you guys, the leaders in the teams here, disappeared for a month on a lovely holiday, would these changes still be in place when you got back? Have you distributed the leadership enough and that there's engagement that the teams who you leave behind will ensure that this work carries on as planned? It's a great thing to be thinking about. That's a sign of, there's more work to be done. How do you know when you're ready for spread? And it's about degree of belief. Do we believe the changes are effective, they add value, they're doable, and that people accept that this, and they think, this will work. There's an intention to spread, that we've actually prepared leadership about the resources that we're going to need, and that we're not going to follow the 7 spreadly sins and about just expect one person to make it all happen. That we have this is an intentional phase of work, and it requires, I think, our leadership around how we're going to do that, because it's the whole organisation approach. Sometimes I think there's a gap in knowledge, and we're still working with that around leadership, and some of the leaders really clearly get that, but spread is a management and leadership activity, and we need to engage them about that to be successful. They need to understand they are a key part of the next phase that we go into. This is out of the improvement guide, and there will be 5 or 6 lucky teams who will have this to be looking at, but it's really got some nice ideas from the improvement guide about some of the things or the tools or things you need to think about to implement effectively. That you have some standardisation around the processes that you do, so that everybody knows about it, and that there's a standard way of a new change occurring. That there's a clear documentation process, so that if you've got new people coming into the unit, this is the new way that we do things. This is how the process. You need to think about, how do we document that this is now the new change that we do. Everyone who comes into our unit is now welcome. This is the way we now do it. This is the process whereby we do it. Having a way to know that it is happening reliable, that we are measuring it, and so we can say, we're doing really, really well. Somebody went away for a few weeks. Look, it's dropped off again. We need to have that measure in place to know that the system is reliably performing with the new changes. That there's a process for staff being educated about this is the new way we're doing it, and that when you go to the next unit that we are actually, this is the way the process happens, this is what you need to do, these are all the processes and the tasks that need to be in place. Effectively managing and I've talked about this, the resource implications. If we get to scale, what does that look like? Do we need additional resources, whatever that might be? Do we need to have a process whereby vaping is accessible? It could happen all the time, for example. Do we have a safe process for storing them? Do we have an area that we now allow? Those types of things that need to be considered if you're going to implement that change. And at the social dimensions of the change, supporting continual engagement with people so that we continue to build that will with the team. So just when we talk about change, we always think about that it's not just a technical aspect. It's a social aspect. How do people engage with the change? Is it doable? Have they had input? That building well, and we use PDSA quite frequently to be doing that. How we make sure that we communicate the information and why we're doing it, what the value is what's in it for them. And you never underestimate the value of what's in it for me or what's in it for them. And overcoming the barriers. And I always find involving people in PDSAs and the theory, particularly those who have your staff who are very good at finding the reasons why things won't work, is useful for that type of thing. And then engaging them about why this won't work and tell us how we could be successful with this change. Use those types of people for that type of activity. There. I think we've seen this slide before. I think this is always good. I always remind people there are no silver bullets. It doesn't. You have to go through the process. You have to go there. People like to let's just do it. The Nike approach. It works Rarely, sometimes, but generally it requires a process and following the methodology to be successful. This is a useful tool. Lynn Ma was involved in this process about innovation and about how to spreading innovation, about 10 key aspects, and I think these are good things to be considering around that. And they're pretty much what we've outlined and said. Monitoring, the changes are adaptable, staff are engaged, there's a process, the organisation, the infrastructure there. So those are all the 10 key aspects that are common that you'll see throughout the literature about how do you start to spread change and implement it on a long-term basis. So just talk about a few of the theoretical concepts around change. So the diffusion of innovation, the psychology of change, and complexity. You guys have all seen this, haven't you? We know that there are the innovators, the early adapters, the early majority, and so those are just things to keep in, that not everybody's going to change at the same time. I mean, it takes process and it takes that continually building will and getting to that critical mass to where this becomes a new normal. The stages of change. People have to think about it, pre-contemplate, is this going to work for us? How around that? Get a bit more engaged with it. Starting to think about, well, actually, maybe this isn't such a bad idea. We can go forward with this. We can perhaps engage with this change. And actually then activating people's agency, getting them involved in the change, getting their input around it. And then how do we make sure that we're reliable about that process, that we maintain it. Complexity. Complexity adds a lot of challenges when you've got change, and that's why we have to learn our way to change in each of our environments, because they're all slightly different from each other. And I liked the analogy about not throwing a dart at the target but throwing a bird, because it changes constantly, and that's a sign of complexity. So thinking about that, it's going to be messy at times, and we need to think about that and learn our way through that. We have to learn to explore, find new ways, and engage other people around that when we're dealing with complex situations, which we all are. We need strong leadership, and I think when we talk about leadership and quality improvement, the one thing I'm starting to learn is it needs to be distributed leadership. We need a group of leaders around us. As I said, if somebody goes away for a while, we need somebody else to pick up the reins. We need other people within our teams allowed to have leadership to say, yeah, I'll have a go at doing that. One of the staff, they can actually pick up PDSAs. They can take a role around that. We need more leaders around us, and we need to build them. And we have to also support our leaders above us about what we're doing and make sure that we're upward managing as well, so they know where the barriers are, what the resources are going to do, and some heads up about what's coming up in the future and how they can support and remove barriers for us. When we have these new change ideas, one of the things about a better idea, it needs to have some clear advantage. People need to see that, yeah, this is worthwhile doing, that it would add value. It's got to be compatible with the environment that you're working with, or the context. Does it work on night shift? Would it work on night shift? Is it just a crazy idea on night shift? So you've got to think about the context of the situation. Is it easy? Is this an easier way of doing things? Have we got rid of some of the old ideas that are not easy? There's got to be an advantage to it. Can we test it? And we've talked about testing, and we carry on talking about testing, but also can we show people that actually by doing this way, we have reduced the unintended consequences, or we've reduced the problems that we were looking at. Are we achieving reducing seclusion by your change ideas? So we need to start thinking about setting up a spread plan. What your initial plan was, the way to start getting people engaged, your communications around that, thinking about scaling up your communications, and probably thinking about what you do now in communicating, probably increase that by 2 to 3 times. At least by 2 to 3 times. We cannot communicate enough. Identify bundles of things that you're going to do. How can you set them up in bundle elements? Makes changes a lot easier. And continue to find, work with the willing insights that people who will quite happily engage with you. Think about your social systems, and it says communication twofold, that's at least, and sharing the technical concept. Your feedback loops, it's great to see how much we've progressed in our data management and your data out there. I think that can continue to grow, and how you put that visual data management out there, what can we do? And somebody asked me today about people who are using either safety crosses or time between charts when you go so many days without an event and an event happens, and it goes back to zero. That could be perceived as negative, and that's why it's nice to have more than one set of measures. And I was also thinking about, reflecting on Dean's comment around some of the things as well about the safety crosses. And one of the things they did in East London Foundation Trust is they did, we had no event, we had a near miss. And I think that's really useful because you can go back and have conversations and learn. It's constantly all teach, all learn, and using in your measurement structures that about what you did then. And I saw some great charts out there annotated about we did this at that time. That then also helps people see, oh, look, we did this, we see a change. So that positive feedback loop is really important as well. The triad of what we need to be successful in spread is our people and all our leadership. And I think I now talk more about distributed leadership. They're equally, if not more important than our senior leadership. The organisation, that it fits with the organisation aims, and that we're aligned, and that we're resource aligned as well, and about the processes around how about we go that, and that what's in it for all those involved, all stakeholders. Plan for setbacks, and this is quite useful. When we see where we've got failure to launch and actually doing anything, have we got stuck into just analysing things to death? Are we actually doing anything about it? And one of our Scottish colleagues taught us about PDSA, and sometimes that could be please do anything, do something. But we need to get on to action as well. We need a theory, but we do need to get on and do action and not just talk about it, co-design it. We need to get on and do things. Clear rationale about why change is not communicated. We need that communication. Failure to sustain. New changes are not supported by day-to-day behaviour. So we've talked about that, about culture as well. Change agents are not we talked about this as well. Knowledge, the people who are leaders, knowledge leadership around those who can help us are unofficial leaders who actually are thought leaders, and they're the useful people. And I think these are all concepts that come back, you hear over and over again, but they are quite important. This is a spread plan, and there's a spread checklist and I think I took this off of some of East London Foundation Trust work as well, but it talks about why the idea is a better idea, where this change idea is targeted, who the population is, what communications have we done around it, improving the odds of the spread. So each target will put some measurement around that, and the start date, when and how. So those are all kind of useful tools, and we have those, or we'll have all these slides on the website for you.